Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Now I want to presentation my article. The title my article is Resilience of Nurses During the COVID-19 Pandemic, the 21st Century Global Nursing Paradigm, a Literature Review. Okay, this topic, our presentation consists of introduction, consists of background, aim of the study, and research question, method, result, discussion, and conclusion. Background: COVID-19 is an epidemic of a deadly disease whose spread is very fast and has become a world health crisis, which spreads very rapidly with the risk of being infection and deadly. The incidence of COVID-19 is the world, according to World Health Organization, is 110 million cases. As many as 84 million have recovered and 28 million have died. Vaccination is one of the preventive efforts for health workers and the community in the future, and the community's lack of compliance in preventing effort to use 3M consists of washing hands, maintaining distance, wearing masks. Global and national healthcare systems can have an impact on health workers who care for one of the nurses. The intensity of nurse working hours too longer with patients than other health professions. This has an impact on nurses being able to experience higher psychological pressure. The causes of psychological stress that occur include the risk of direct exposure to the virus from the patient, to use of personal protective equipment or PPE with asthma for a long time during work shift, the risk of nosocomial infection, the fear of transmission of coronavirus contamination from nurses to family members at home, feeling rejected by others, and social isolation. This triggers anxiety, fatigue, depression, low back pain, or musculoskeletal disorders. Nurses are human beings who are part of the vanguard. The role of psychological resources is needed. Support from colleges and the government. Individual resilience that can be used to reduce adverse effects while caring for COVID-19 patients, namely the ability to survive and adapt firmly in difficult situations. Research on nurse resilience during the COVID-19 pandemic has not been carried out much result. Therefore, it is necessary to summarize the literature aimed at identifying the resilience of nurses during the COVID-19 pandemic. Aim of the study: describe resilience to nurses during COVID-19 pandemic as the front line. Research question: are the results of the review related to nurse resilience during the COVID-19 pandemic as the front line? Method: a comprehensive summary in the form of the literature review. Protocol and evaluation from literature review use the PRISMA checklist. The literature review result in this case use 5 databases with high and medium quality criteria. Consists of Scopus, ProQuest, PubMed, and Science Direct. The short results that have been obtained are then checked for duplication. It is determined that there are 60 similar articles, so they were excluded and the remaining 140 articles. The author then conducted a screening based on the title, 140 abstract. Title abstract is 40 abstract and full text is 25 article. The result of a review of 10 articles found that the form of psychological factor during the COVID-19 pandemic, mental distress, and influencing factor in nurses caring for patients with COVID-19, resilience nurses during the COVID-19 pandemic. Conclusion: the 21st century global nursing paradigm, one of global problems in the health sector. With the outbreak of the coronavirus disease COVID-19, the role of nurses as a front guard is needed by the community to provide health service in line with the increasing incidence of COVID-19 cases. Strong nurses need adaptive inner coping mechanism. Thank you. Assalamualaikum warahmatullahi wabarakatuh.